I think we've got to look at dentistry as a whole. Whether you go to an NHS dentist or a private dentist, ultimately you're going to a dentist. They're just two different financial systems. Um, if you go private, doesn't necessarily mean that you're about to see a much better dentist. You like to think so, but sometimes it's just a dentist working in a private setting. And as dentists, we all have our own level of skill, our own level of quality, and no two dentists are the same. Um, the country's always operated on NHS dentistry, and that's the most available type of dentistry to get access to until the recent years. It really started to plummet. And I think the main plummet came in 2006 when the government decided to change the contracts and change the way they remunerate dentists. And it's important that people really, really understand this. And the most basic way to tell a layperson is that if you call a painter to your house and you get a quote to paint the bedroom, let's say he says it's £50, and then you say, "That's fine, pal. Can you paint my whole house for £50?" He's going to say no, probably give you an awkward look and drive off. And essentially, that's what's happening to dentists within the NHS. They're not being rewarded or remunerated for the level of effort that they're putting in. They're expected to do a whole load of work for a set fee, and it really doesn't work. And the NHS operates like this on a whole. Um, the inception of the NHS in 1947 was to provide healthcare that's absolutely necessary at the point of time when someone needs it. And that's what made Great Britain really great. And over the years now, we've seen our NHS collapse and diminish and diminish. Now, dentistry is a small section of the overall health system. So you've got to look at the health system as a whole. NHS dentistry is not just collapsing. NHS medicine's collapsing. Our A&Es are overrun. Our doctors are suffering. Our angels, our nurses working in the hospitals are suffering. Mental health is on the rise. If you can't really support doctors and nurses and ensure their well-being, how are they going to support the well-being of others? And I think that's the main problem. And that's what everyone needs to sit down at the round table and find the right solution for it. Because as soon as you fix that, the ripple effect will start and automatically NHS dentistry will be solved. But right now, we've got a system where you get different proposals from different politicians. And I think the British Dental Association made their stance super clear. It just doesn't work. The banding treatment, they just don't work. The band one, band two, band three. Why it doesn't work? Let's go a little bit deeper. You take an NHS checkup. Average time for it is about 15 minutes. What do you get? Not always the same dentist. You get two bite wing x-rays that have a quick snapshot of your teeth either side. A quick assessment of the soft tissues, the gingivae, and an opinion on your teeth. And 15 minutes is just not long enough for two human beings to interact, get to know one another, to explore your diet history, explore your social history, explore your background, maybe previous experiences with dentists, maybe what scares you when you go to the dentist. I think if you just talk about that one topic, you're well over 15 minutes. So dentists are forced to work in this system. And if they don't work to this system, as in seeing everyone 10, 15, 20 minutes, the system collapses. The practice will shut down within a week. I know it's hard for people to understand sometimes, but dentistry is very unique. Overheads are massive. It's not like any other profession. Seriously, it's not. You might feel like you're paying loads and loads and dentists are making loads of money, and it's really not true. Dentists work super hard and they don't get paid essentially what every patient's paying to the practice. They're getting a fraction of what's coming in. It costs a lot to run the service. And that's why you're finding principal dentists, business owners across the country are leaving the NHS. And that's the problem, really. That's the problem for us all as a whole. You know, as a dentist, I could sit there and be like, oh my God, that's great. Yeah, we're all going private. We're all going to do better. We're going to do more. But that's not the case. It's not the case. I mean, it's quite simple. You look at the statistics, and the average person in the UK's earning is 28 to 35,000 pounds per year. How are people going to afford private dentistry? You know, and it breaks my heart. I have patients that come into me just last night. A fella came in. He's got a impacted wisdom tooth. He needs it surgically removed, and it's going to cost X amount. And he just said, "Listen, I just can't afford it." It doesn't matter who I call, what I do. I don't have anything in my savings. I can't afford it. And there's so many people in that position. And it's awful. It's awful, really. Um, you got to understand dentistry and understand the impact it has on people's lives. A smile is everything. And dental pain is one of the worst pains you'll ever experience. Ask anyone that's suffered from a really bad toothache. It keeps you all up, keeps you up all night. Everyone in the neighborhood knows about it. It's really severe. If you go back a couple hundred years, you'll find that one of the leading causes of deaths were actually dental abscesses. Luckily, with the antibiotics coming along and a few other interventions, it's become more of a rarity now for someone to die from a dental abscess. But you just have a little think about that and think that how severe a dental abscess can be if left unchecked, if left untreated. And actually, today, as we speak, in A&Es across the country, there'll be one, two people in every A&E coming in with a really severe dental abscess. It was blown out of proportion. Their face is out there. It's gone into their neck space. And if that's not treated very fast, it can start to close your airway off and ultimately would lead to death. So dental abscess should not be overlooked. It is serious and it's happening every day. There's surgeons, maxillofacial surgeons in every day taking people under general anesthetic on an emergency basis to provide incision and drainage to save the person's life. That's what's happening. That's what's happening. And if you don't start to make a difference to the way dentists are funded and people's access to dentistry, you're going to see more of these cases. And, we don't want to see anybody suffer in that level of pain. There's a lot to do. And in the current system that we're in, it's really not working. It's really not working. I mean, the stats will show you again, more than 50% of adults can't get access to an NHS dentist. The problem is if people, just have endless money, it's fine. You go and find a private dentist possibly and get on with the treatment. But actually, there isn't that many dentists available either. So you're stuck whether you've got money or not, really, to some extent. I think the main thing people are suffering with right now is access to NHS dentists or access to a dentist. And really, people need to know what to do if you're in pain. If you're in pain right now, I know it's difficult, but just take a moment, breathe, get some advice, take some over-counter medication. As long as you're not allergic, seek counsel from your GP, but normally paracetamol or ibuprofen are the first-line medications to try and tackle the toothache. Please don't overdose. Taking more painkillers than you're allowed does not lead to anything good. And one word of advice, normally dental pains are a sign the human body is telling you that you require some intervention. And painkillers may dull the pain for a while or even make it disappear for a while, but it doesn't mean the problem's solved. It normally comes back with a vengeance. So you do need to seek urgent advice, an urgent assessment, get the x-rays done, get a proper diagnosis and take action. Otherwise, it will ultimately lead to something very, very severe, which is avoidable. Now, you're in a position, you need to find a dentist. You can't really afford private dentists. You've called 111. They're doing the best they can to get you to an NHS dentist. Now, there's something you need to know about the different services available to you as an NHS emergency dentist compared to what I'd like to think a private emergency dentist does. If you end up calling 111, you see an NHS emergency dentist. If you're lucky, they might take the tooth out. If you're lucky, they may provide nerve removal to alleviate the pain. They may provide a temporary filling. They may give you antibiotics. You find more and more patients are visiting NHS emergency dentists from the 111 and are simply walking away with a prescription. A lot of them still remain in pain, and quite simply the reason for that is not all NHS emergency dentists are skilled enough to remove the tooth. Quite often, tooth extractions can be complicated. And again, the number of dentists available nationwide that take on surgical extractions of complicated teeth are very, very rare. So ultimately, you end up staying in pain. And then you're forced by the system ultimately to somehow dig up some money from somewhere to go and see someone that's going to provide that service. Because even if the dentist refers you on the NHS system, Their waiting lists are anything from 6 months to 2 years, and it's awful. It's really, really awful. And I don't think this problem's going to be solved overnight, but I can assure you it's not going to be solved with these little proposals that keep coming in the news articles, to remunerate dentists with a one-off fee, or, we'll increase the banding, or we'll increase dentist wage by £1. I don't think that's going to solve anything. Um, Really, you've got to go back to the root cause. And, I've mentioned earlier that the root cause really is the way the NHS system is operating as a whole. From, you've got to go back and explore the doctors, explore the way hospitals are running, explore what the NHS is doing. It's gone way off track from where its first inception was. And ultimately, until you solve the NHS system as a whole and its delivery of healthcare, you're never going to solve NHS dentistry. The only other word of advice I've got, if you have some money to spare, because we looked at this as a practice and we decided, well, what can we do to make our service more affordable? We have a private dentist at Bespoke Dental Implant Clinic, and we came across Denplan. They're a nationwide provider. They facilitate dental practices to provide membership plans for patients, for private fee paying patients. But the reason we went with Denplan is because of the perks and benefits that they offer. So, for example, every practice charges something slightly differently, ranging between £20 to £30 a month, and that covers your routine dentistry, such as your examination, your hygiene visits, and X-rays. But one huge perk is that you get a £500 worldwide dental emergency insurance cover. I mean, that is, a golden ticket when you're in pain. It allows you to, doesn't matter where you are in the world, call up, fast track yourself to a private dentist, get your treatment done, because nobody can sit there for days with a toothache. So that was, I think, one massive benefit that we felt that our patients could get. So we signed up with Denplan, and we've only been with them for a few months, but honestly, it's helped a lot of people. It makes a huge difference. Not only that, Denplan has other amazing perks. Like, for example, you could get this additional upgrade. It's £2.25 extra per month, but you can get up to £20,000 trauma cover. You can get up to £2,000 per implant. And, believe it or not, we all at some stage suffer from some trauma. I mean, I have a really bad trauma coming into my surgery once a week. That could be a cyclist, it could be an injury from a child at school, it could be absolutely anything, and they've just completely smashed their front teeth. And your front teeth or your smile is absolutely everything to you. And, just to give you a quick example, if you've broken your front two teeth, to replace them with implants, you're going to end up spending anything from £4,000 to £8,000 just for your front two teeth. It's expensive. And if you had a cover like with Denplan for an extra couple of pounds a month, I think it really goes a long way.